Hello lovelies, and welcome to this week's video. My name is Alya and I'm so glad you stopped by. Today we're talking about spots. Are you seeing spots in your vision? So I'm going to talk about a few different kinds of things that can happen and what your clinician might be using to find clues about where these spots are originating from. How serious are they? What kind of an emergency are you in? Or are they completely safe and normal and nothing to be rushing to the ED about? So hopefully you'll find out a lot about your eyes in this video and you enjoy me creating this beautiful look with some Aether Beauty and Double Down Cosmetics products, all natural and non-toxic and absolutely lovely and fun to use. Comment below and let me know what you thought. Let's jump into the video. Okay lovelies, I'm really excited to do this really fun green look. I'm going to be using some gorgeous colors from this Aether Beauty palette called Joshua Tree. Lovely greens in there, as you can see, and some fun yellows and peaches and whatnot. But the best fun is we're going to be adding some dazzling green called the Unity by Double Down Cosmetics, my new fave. And together with a beautiful green liner, we're just going to have this beautiful, magical, sparkly but calm green look at the end of it all. Spots. Let's get straight into it. There are different kinds of spots. Some are really quite the worry, and then there are others which are completely benign. And how do you tell the difference, and where do they all come from? So I'm going to be dividing today's video by the kind of spots that you might be able to see, by the symptoms. So if you recognize any of this, you'll know exactly what it might mean. The symptoms alone are not enough to diagnose what's going on, but it's definitely an indicator of where things are coming from. I'm not going to go in any particular order of severity or seriousness or innocence or anything like that. I've just come up with a list. I'm going to go through it. So you'll need to watch through to the end of this to see if your type of spots are in the video or not. So let's start off with a grey patch that might pop up pretty randomly at the center of your vision. Now it might start off as a bit of just a blurry patch, and then it might develop like a colorlessness or a grayed out or fogged out kind of appearance over time. So not necessarily days or anything, sort of hours, could be days. So this grey patch is very common in younger people, and it can go away by itself, but then can come back as well. It can also be brought on by stress or heavy lifting or numerous things. Now, there's actually a kind of grey spot that's known as the CEO's kind of retina. That's caused typically by a very high stress job. So if you're in a very high stress position, or you've been in a very high stress project or something like that, you may experience this. These are things that can resolve more quickly and more simply with a bit of medical involvement, but can also resolve on their own. So this is something that, I mean, any kind of change to vision should be shown to a professional just to be sure that you're not in any danger, but at least you know that some of these things can self-resolve. So you don't have to be too worried until a doctor tells you to worry, pretty much. Now, sometimes these grey spots can be caused by traction that happens between the jelly and the retina and the eye. I have a whole video on PVDs. Sometimes this can be caused by swelling in the actual macula itself, caused by stress or caused by fluid, very common in diabetics. And sometimes it can be caused, especially with age, can be a sign of macular degeneration. So that's a little bit more permanent and a bit more of a worry, but usually happens much later on in life. But what if you get a large black spot, something quite dense, you can't really see through? It's not just grey and foggy, it's a full-on dense thing, and it's kind of moving a little bit as you move. Those are known as floaters, and they don't have to be big and they don't have to be small. They don't have to be alone. There can be many little ones, can be one big one, can be two big ones, can be many big ones. Unlikely though, but it can be. As long as it's mobile, you can pretty much rest assured that it's something that's kind of come off and kind of clumped up inside your eye. These things can come on suddenly, but they could also be disguising something much more sinister underneath. So I would definitely be making sure that there's nothing else going on, and that bit that it's come off of hasn't torn or isn't continuing to bleed or anything like that. But if it's just confirmed that it's a floater and nothing more, then the good news is that these things are not dangerous. If they become a nuisance to your vision, they absolutely can be operated on, but a lot of the time they're just left alone. As long as it's not interfering with you being able to see, it tends to be quite a severe surgery to go through to remove floaters. So often surgeons that perform this type of surgery won't want to do it unless it's actually affecting your vision, because there's always a risk with surgery. So surgeons tend to be a little bit conservative when it comes to actually operating on a perfectly healthy eye if it's just a nuisance of a problem rather than an actual functional or visual problem. So you definitely would want to be seen by someone just to make sure that you've got something that's pretty benign and safe. And to also make sure that you're safe to drive, you're safe to continue with your daily activities, all that sort of stuff, because you wouldn't want to just assume that kind of thing. It's very important that those dots are moving though, because if they're not moving, they're a different kind of dot. So if you have a large black dot or even a small black dot and it's not moving, it's just kind of always there, that's a bit more of a concern. Then what you're probably dealing with is some kind of blockage or some kind of leakage or something that's actually causing those cells in that area to stop working. Whether it's the cells themselves that have stopped working or there's just something blocking them, that's something that needs to be determined. Usually the best way to determine it is with a scan, or sometimes just a photograph is sufficient, or even just a professional just looking inside your eye can sometimes be sufficient. Although that's a lot more of a simple kind of exam, it can sometimes tell you what's going on. Especially if you have a high blood pressure and you haven't been great with your tablets, or you're on blood thinners, or there's something else going on with your diet, or you've been doing a lot of working out or under some sort of extra stress. It's very important to tell all these things to your clinician, because that will give them quite the indication about what's going on. So if you have a black dot that doesn't seem to be moving and there's just a patch in your vision that's just not functioning at the moment, there's a really good chance that you could have a little occlusion in one of your vessels. When vessels occlude, it can be actually quite dangerous to your sight long term. It can cause quite a bit of swelling if left unseen to. So it would be really, really great to present to a doctor as soon as possible if that's what's going on. So it's important to really, really get onto that sort of thing quickly. But sometimes a spot isn't a spot. Sometimes it comes on more like a veil. Now, it's pretty hard to imagine what it would be like until you actually go through it or see it on a scan from a clinician's point of view. I've seen enough of them on a scan to sort of imagine what it would be like. But a veil is quite different from a spot, even if it's a large spot or not quite a round spot. And that it's kind of like a meshwork. And it won't just come on its own. There'll often be, before sort of the veil comes on, there'll often be some bright flashing lights or some bright spots or some sparks, or some people report like a lightning bolt or some kind of other symptoms before this veil comes on. And when the veil comes on, it only seems to be getting bigger and worse. If that's the case, there's a chance that the retina may have torn or detached. Again, definitely an emergency, definitely an ER kind of, or ED as we call it here, kind of a thing. It's something you don't want to wait on. If you don't have an ophthalmologist handy, you just want to go to emergency. This is not something that you can kind of walk around with and live with. This is something that needs to be seen to, within the first 48 hours at least, if not sooner. Any kind of bleeding in the eye can cause swelling, can cause disruption, and you really want to put a stop to it and reverse the swelling as soon as possible. Dry up that blood and let the eye recover. If it is in fact a detachment, if you catch it really early, you can use a bit of lasering to stop it from detaching, to sort of stick it back on. Then you can avoid really full-on surgery, because retinal reattachment surgery is really, really difficult, really, really fine, and there's never totally a guarantee that things are going to end up well, although they're very good at doing it these days. Definitely doing some laser to fix the problem before it's gotten really bad is the much, much safer route to take. But what if you get white flashing lights, white little spots, or some sort of light spot effect, and they're not black spots at all? They're just light flashes or little white, sort of like a rain. Some of my patients have reported that from dry eye. I've even heard one patient sort of describe it as lots of tiny little squiggles or little worms. And all that is just you can see the tear film moving around if it's a bit sparse. You can sort of notice the way that the edges of the tear film catch the light if there's not much tear film there. So it's almost like looking through a window on a rainy day. It's not a fully wet window, it's just lots and lots and lots of droplets that are readily moving and readily evaporating. So if you have quite a dry eye, you may notice these things in the right light. But more likely than not, it's probably the jelly that's moving around and causing these effects. If indeed the jelly is moving and pulling and tugging on the retina, again, you want to make sure that nothing's tearing. The thing to remember is the retina doesn't see everywhere. There's definitely sight everywhere, but we don't really use all the sight. We have a lot of peripheral retina that's just never really consciously presenting vision to us. So it's important nonetheless. So if sometimes it tears, we may never really notice it because we're not using that part of the retina, but we still very much need that retina to be healthy and intact. When something is pulling at the retina, especially in the periphery, you will often find that because the retina can't actually see in of itself, vision all happens back in the brain. All the retina can do is tell you that it's being stimulated somehow. So the most simple way of saying something's going on here is with a flash of light. That flash of light can be in any kind of presentation. It can be a little horseshoe, so like a semicircle or a crescent moon. It can be a bolt of light, so just an on-off kind of flash kind of effect. Or it can be lots and lots and lots of little spots because it's just a generalized kind of effect and you can't really, or the retina can't really tell you where it's coming from. Sometimes it's being caused by migraines. That's definitely a very real symptom that migraines can cause. It can be sometimes something that happens much further back in the brain. It has nothing to do with the eye itself at all. And sometimes it's got to do with some activity that's happening within the jelly of the eye, and it's just pulling or pinching some nerve somewhere and causing an effect. It's really important to make sure that that is just an effect. It's just something that's passing through, not something a little bit more permanent. I'm going to put on my beautiful The Future by Double Down. Love this beautiful stick, and it's beautiful peppermint oil in through it, so it makes the lips feel lovely and tingly. Things that happen at the back of the optic system in the brain, in the occipital lobe, are often colourful and are often shaped because things are much more organised back there and much more like vision rather than just like light. So some people report seeing prisms or colours or kind of a kaleidoscope effect when something happens at the back of the brain. So migraines often do come from the head rather than from the eye, and in that case you will get more of a colourful effect, or maybe you'll see shapes, or maybe the vision just disappears temporarily altogether. But if it's temporary and often followed by a feeling of being sort of hungover, it is most likely something to do with blood pressure or migraine or some sort of spasmodic feature in the head. Whereas if it's a little bit more simple, a little bit more of an on-off effect or something like a shadow, then you're more likely to find that that's something happening inside your eye. Alright, my lovelies, I hope you enjoyed today's very sparkly look. I am absolutely loving these double down little loose pigments. They're just fantastic. I have some on my cheeks, on my eyes, double down on the lips. Beautiful company, and of course goes really, really well with the beautiful natural ingredients in the Aether Beauty. So all naturally beautiful things. And how lovely is this green? I mean, just absolutely loving it. I've even got a little bit on my inner corner there. Just a little alternative to the browns and blues and blacks that you see a lot of, so something different and not too bright, which I really like. So it's still lovely and subtle, but a bit of fun at the same time. If you like this look or finding out a little bit about the eye, please do hit like, and don't forget to subscribe for more of these type of videos. Head over to Instagram for some more real life stuff that's happening all the time. Wherever you are around the world, my lovelies, I hope you're staying safe and happy and looking after yourselves, and I can't wait to see you on the next one. Bye!